Is British Columbia's Public Health Officer Dr. Bonnie Henry smoking some of the safer supply drugs she's also eager to get in the hands of more British Columbians? Don't shoot the messenger for asking that question. It's a question circulating online after news broke about her report proposing that the BC government expand the already highly criticized Safer Supply program to include the exploration of having non-regulated, aka highly addictive drugs be on non-government and retail shelves. Let's talk about it. Drea Humphrey here with Rebel News, standing in Vancouver, a place known for its beautiful views, its mild climate, and being coined the fentanyl capital of the world. In British Columbia, over the last 8 years, over 14,000 people have died from drug overdoses, an experience and crisis that is all too familiar to the area I'm standing on, the downtown Eastside, Hastings Street, where approximately 5,000 active users engage and frequent a 10-block stretch. We're going to talk to them in this report about some of the radical proposals, at least many think, that BC's top doctor, Dr. Bonnie Henry, just proposed to the NDP socialist government. Now, surprise, surprise, call it logic returning to politics, or maybe just the fact that in a few months there's going to be a general election. I should let you know, the BC NDP government actually rejected Dr. Bonnie Henry's bid. But let's see what some of it was. In her report, Alternative to Unregulated Drugs, Another Step in Saving Lives, she begins off with suggesting that much of the problem that we're seeing in areas like this and across British Columbia is due to white supremacy. That's right. You can read it here. She wants to talk about getting rid of white supremacy to address the problem. But that's not the only thing that stands out and made its rounds on social media and the news alike. She gives 3 suggestions. Perhaps one, giving license. So that means the tax dollars would go into putting highly addictive drugs in retail and government spaces. That's right. Put it on the shelves. No prescription needed. Let me know in the comments what you think about that. And I'm going to ask people in this area what they think as well.
And it has changed because of some of the, quite frankly, misinformation, disinformation, the discourse that's out there.
Misinformation, disinformation, conspiracy theorists, we've heard it so many times before. And usually, whenever Dr. Bonnie Henry speaks, the NDP government always backs her. For example, her excuse for still having a COVID-19 vaccine mandate that's restricting thousands of healthcare workers from saving lives, despite our healthcare crisis, which desperately needs more workers.
Well, British Columbians know Dr. Bonnie Henry is an outstanding scientist and an outstanding House leader, and certainly, Honourable Speaker, has a stronger knowledge of evidence than the Leader of the Opposition.
Now, this report that came out was dated July 9th, but it really became public knowledge July 11th. And immediately the Conservative Party of British Columbia condemned it and actually called for the resignation of Bonnie Henry.
This is a government that has already shown it is incapable of safely managing the so-called Safe Supply program it already has running under the medical framework.
And not too long after, the BC NDP said no. They're going with a different approach, one that includes incorporating the medical professionals.
We will not be pursuing projects or proposals that deviate from our determination to connect people who are struggling with substance use disorder to the kinds of care and support that they need.
Now that you know what the political leaders have said about the suggestion, let's see what people who frequent the downtown East Side have to say as well.
No, we'll grab some. Got lots of stuff. Oh, got purses too, hey?
But the government, our public health officer, is suggesting that to address addiction or our overdose crisis, that we allow non-medical professionals to sell drugs like heroin.
You're gonna die if you do like this. It's no good.
Yeah.
It's dangerous. Because no control, right? they're going to do lots, so I think it's not a good idea.
The reason why people have a license to kill, pharmacists have a license to kill, right? And doctors have a license to kill. And where my friends who otherwise do it without that license, it's not real money. You know, they're doing it in a lot of cases for the fact that they're trying to keep these people alive.
Do you think that would actually help the overdose crisis?
I honestly, no. I don't. It's depending, because then you'll have people that are vulnerable being like, oh, cool, kind of like vaping, like how they made smoking cigarettes. They started putting the writing on the filters, but they made it illegal, and they stopped making a vape juice that has no nicotine because it makes it advertising to children, to youth. But now they have these, but they're still flavored vapes, and I'm walking around Granville and I see all these packages. I see all these young girls smoking. It didn't help. It just kind of curved the law.
They get their hands on it. What's your
and then like with legalizing weed, it's just a tax thing. It is. So what? The government's going to gain.
Someone's making money.
The government wants to gain taxes by killing. By like, what's going to happen now? You're made something that you can buy from a store, and that's going to get in the hands of a child. No problem. No problem at all. Why? Because what? There's fake IDs. People all around the world come here just to take videos of us and watch us kill ourselves.
Recently, the public health officer, just a couple of days ago, suggested that a way to help the overdose crisis would be to allow hard drugs to be available for sale in retail and government spaces. What's your thought on that, if that were to pass?
It could work. Yeah, government approved retail drugs probably could help. Yeah, and less of a stigma. People are still afraid to use in public, not in public, but everyone's always hiding, right?
Now, you mentioned how the drugs that the government will legalize are not quite what people want to use. Is that what you were suggesting?
Well, no, I'm just suggesting that it's not easily accessible. Like, there's one program here where you can go and get fentanyl, but it's a long lineup to get in there, and it's not exactly as strong as people may require. So they're still having to go outside of this program to get better. Yeah. Not even to get high, just to feel okay.
Some people think the government are allowing the fentanyl because they can't do anything with these people to kill them off. As fentanyl gets in the country, and it gets in seemingly very easily, what are you to think? Is the government really making an earnest effort to stop it and to help the people? I don't think so. You know, drugs isn't just on this street or just in this neighborhood. They're everywhere. People in high positions, lawyers, etc., we all know they're using. The only difference is they have a good career and they're able to cope with both, right? They've got strong enough minds, I guess, that they can deal with both and continue to live a good, a normal life. So I believe that drugs should all be legalized. Get rid of the crap like this jib, which is burning holes in people's brains, and I firsthand have witnessed how it completely changed a person.
Sorry, what was the name of that drug?
Jib, or crystal meth.
Some of the measures that have happened recently, like there was the decriminalization of open drug use, and then they backpedaled on that. Is that good or bad?
Your Bonnie on the TV said something about, and then they want her to resign for saying that.
Yeah, you're right. We're asking people about this. So she essentially suggested that, the drugs go on the shelves in the retail and no prescription needed. What's your thoughts on that?
I think that is an awesome idea. The rate of overdose will go down quite a bit. We'd be losing less people.
If you believe that more needs to be done to help people struggling with addiction than just politicians pointing the fingers at each other or creating policies that enable people to use more hard drugs, we agree. Go to our special website called fixourcities.com and sign and share our petition today. And if you appreciate reports like this, you can also chip in a few bucks to make them go strong.